given me a little bit of time this morning, and I'll sprint through these slides pretty briskly to save everybody's time. But I wanted to talk a little bit about co-production, co-creation, and research engagement, which are topics that I've been engaged with for a number of years in various organizations. And I also wanted to introduce a little bit about what is happening here at Nemours. So quickly about me, as Erin mentioned, I'm newly, like less than 6 weeks, I think, academic support librarian at Nemours Children's Health. Previously, I worked at the University of Pennsylvania, the College of Osteopathic Medicine, a number of other places in health sciences research. I'm a planning committee member of the Research Family Partner Program, which is something that's emerging here. I've been the research work group co-chair of the Fontan Outcomes Network, which is a research collaborative in single ventricle heart conditions. And I occupy that position as kind of a family/parent representative. And I'm also sort of relevant to this, been a member of an organization called AERIO, the Consortium to Advance Effective Research Ethics Oversight, where we do sort of empirical research into IRBs, into clinical ethics groups, to see what their organization structure and effectiveness is. So just briefly, this is a representation of sort of the types of patient engagement in, all kinds of research. At different levels, sort of historically and currently. All the way on the left, you've got, I think, what you would see as the traditional model of what a patient or a family or a stakeholder, a public stakeholder's level of engagement is, which is like as a subject, sort of subject to the research, not involved only involved as somebody who is the sort of the source of data which is extracted from them. Over the years, this is a very old quote from a social psychologist, Carl Lewin, noting that research needs the help of everyone. And this is, there are a number of sort of historical jumping off points for patient involvement. And you can think, and I'm going to use sort of some language here that is sort of from the communities of, the people who have, who use these terms, but, the deaf community, the autistic community, sort of the CRIP community, the queer community, have all been partners in kind of moving us along this ladder of engagement, or this hierarchy of patient involvement in research. So historically, you can think of, the classic quote from the disabled community of "nothing about us without us," is one of the kind of the calling cards of this movement, but also, the responses of the people with HIV/AIDS in the kind of the late 80s, early 90s phase of that epidemic, demanding to be heard in the sort of the halls where research decisions were made. And then sort of moving forward, into these more and more engaged opportunities, just from merely sort of at the beginning, and there's some definitions on the next slide, from the bottom here, just consultation. Sometimes it's really, useful to consult with stakeholders or service users or patients. And those consultations may affect changes in the research. It's very kind of lower level, but at least kind of people are being involved and heard. I partly come to this from, I am an ethicist. I am a member of the ethics committee at the hospital here. I have academic training in bioethics. And so I think of this in part as a justice issue, in that people who are either the people who the data is extracted from, or the people who some kind of transformational change is going to be enacted upon, they have a right to be part of the process of change. So as a justice issue, it's sort of one thing. There's also an effectiveness issue. It is kind of, reasonable strength of evidence that various level of engagement of research subjects in the research process, or the creation, consultation, co-creation of research, does lead to, improvements at various outcomes, various processes in the sort of creation and performance of research. But, here you see from consultation to research engagement, people from outside the institution influencing some decisions, and often they're fairly sort of narrowly drawn and often drawn to meet the needs and interests of the people who are in charge. And then you've got in the middle here PPI or PPIE, patient and public involvement, which is becoming sort of more normative and expected. We have kind of PCORI, here in the States, where a high level of patient and public involvement is a requirement of funding. They have very generous funding. The process by which you apply, has to include a pretty well detailed description of how you're going to involve patient stakeholders in a meaningful way. And this definition comes from the National Institute of Health Research in England, and in England, having patient and public involvement and engagement is, almost becoming a norm in like a majority of health research, particularly in certain areas. And then there are higher levels here of co-design and co-production, where the patient, the external stakeholders, are instrumentally involved in all levels of decision-making and execution of a research project. And we often fall in some place in the spectrum of these. And we talk about like the benefits, this is a British organization, UCL Partners, describing their strategy for engagement. And they ask why, right? So, valuing expertise is clearly, when you're doing research in certain populations, there's a lot that you or we as researchers, as people who don't have that lived experience, don't know. There's kind of an implementation argument to some of this, that if we know what the barriers and facilitators of the, people with a condition in a social situation, whatever the subject of research is, that must be useful in some way. And as I mentioned earlier, there's this equity argument. That equity argument is sort of particularly resonant now because it does sort of walk over into sort of meeting some of the diversity expectations and imperatives that are much more in front of us at this point. Pragmatism, sort of usefulness, and again in some contexts, particularly abroad, but here with PCORI, simply going to need to leverage those sources of funding. So here's a lot of this takes place in the sort of the adult space, in the social services space. It's grown in other areas outside of particularly like basic research, and to some extent health research generally, and a little bit less usual in the kind of the pediatric space because of those particular problems. Issues of getting children as research partners has its own sort of unique difficulties. But here's an example. A citation here is sort of a scoping review of children and young people's contributions to PEIE and health related research. They're really kind of squarely in the world of what we're doing. And it's an interesting read, but they do point out that you can successfully involve children and young people at every level of health related research, from just sitting down and talking about how to design the study all the way through to design, dissemination, and implementation. And particularly, and I'll talk about this in a few slides, this dissemination part is important, with certain types of research. We want to be able to make it available to people. We want to be able to promote it so that, in some cases, so that engaged groups and patient advocacy groups can be aware of it and start to kind of call for it and make it happen. And it's not as feasible to do that after the fact, to say like, here are the research results. Now we would really appreciate for you to go and promote them amongst the clinical groups that you belong to. it is easier to do that if people have been involved all the way through the process. But, the question has been asked. This is sort of an earlier editorial from Nature saying, pointing out that, at that point, this is 2013, it says on the third column, the evidence base for PPI's impact is meager, patchy, and largely observational. And, this editorial called for, doing more detailed research into what good it is. What is it good for beyond the kind of the expectation of justice and equity and rights? Does it help? So, I've been involved for 6 or 7 years in an organization called the National Pediatric Cardiology Quality Improvement Collaborative. A couple of years ago, this article evaluating the outcomes of that organization, Power of a Learning Network in Congenital Heart Disease. That organization is a multi-site collaborative quality improvement initiative, and you can see the goals here. Initially, the goals were to decrease interstage mortality in HLHS, hypoplastic left heart syndrome, which was, very high at the initiation of the collaborative, and the groups involved recognized that participation and collaboration in a larger entity would help them identify ways to improve outcomes. So growth failure, was also significant, and then reduced the number of infants readmitted due to major. So, really kind of important, significant drivers of outcomes and, expense and difficulty. And what was at that point sort of relatively novel. It wasn't the only organization. It used some kind of predecessors for lessons. Improved Care Now was the one that it drew a lot of its guidance from. But co-production with parents, and then as now, NPC-QIC has parents and family members, and now actually to some extent patients, because we have a cohort of people with HLHS who have matured into sort of adulthood and, even like a little bit of parenthood in some cases, which was considered sort of unfathomable kind of 10 or 15 years ago. But, we have this very real, very significant participation and collaboration between parents and families. So NPC-QIC co-produces research, unquestionably. So we partner with clinicians, cardiologists, cardiac surgeons at every level, from leadership down to, the local site teams at the hospitals who are, thinking about and doing local quality improvement work. And you can see here on the graph side, this is kind of the impact of this collaborative. This mortality, was significantly impacted. I think the description now is that with this collaborative reduced mortality in interstage, which in HLHS is 0 to 6 months. Got a very significant period, for that condition between surgeries. Had reduced mortality by 40%, which is, astounding in a very kind of what is thought to be intractable and uniquely difficult health condition. So, we can see here as an example, an initiative, a partnership, a model which was incredibly kind of impactful through co-production. But even at the, sort of more local sort of, not really particularly trivial, because this is kind of an important, everyday experience of, thousands and thousands of kids, sort of from this very big sort of population level co-production to drive outcomes here to a sort of a workaday kind of example. This is a study that was co-production between clinicians and family members to improve peripheral venous cannula insertion in children. They produced this guideline, this key consumer-focused, consumer-friendly, how to identify difficult, as DIVA is difficult intravenous access. And, between the clinicians and the parents in partnership produced this very reliable and useful instrument, which was shown to improve the process. Sort of a very sort of useful outcome. The great model for creating some of this is created through individual researchers having that awareness and knowledge of the structure and process and model and creating it for themselves, and sometimes going outside the institution to do that. What other hospitals have done and what we're looking to do is to create a research family advisory council. So this is Sick Kids Toronto, who are pretty sort of forward in this space. And there's a recent paper here describing how they set up their research family advisory council and what the the barriers and facilitators they had found, how they designed that to make sure they had a high level of meaningful patient and family engagement. And there's a quote here from one of the clinician scientists, incredibly valuable, really helpful in helping them set up and create and conceptualize the research work they were doing. And then on the family side, most family members find this incredibly enriching, in multiple ways, and feel like they're contributing to the success of these projects that are important to them. They, are driving engagement. They're passionately committed, and they work hard to make these projects successful. What we're doing here, so I'm just taking a look at the time, this is my last slide. We've been meeting a small team at Nemours, across the sites in Florida and Delaware, for about a year now, and sort of working through the business plan, setting up the concept. This is our current guideline. Nemours will strive to develop a sustainable framework in which Nemours research investigators collaborate with diverse family members and patients over the age of 18 as research partners, including co-investigators and co-authors of publications where eligible. So we're going to work in the next phase, once all of this is approved, in establishing sort of the training and preparation models for family partners, because we want to make sure that, I've learned this from doing IRB research on external partners, that there are unique difficulties which can tend to sort of marginalize the contribution, and satisfaction of external stakeholders and non-scientists and community representatives in IRBs. We should have a pretty good idea now about what those are and how to sort of minimize them. And then, and also training clinicians and researchers on these principles too, sort of making sure that they're prepared to sort of onboard family partners and research partners in a meaningful way. And then, we're going to formalize the guiding principles for the group. So, at some point in the next some months, again, I'm new to Nemours, so I don't always know how long things take to be implemented. We expect to be able to promote this research family partner program, and it'll be called either this or some similar name that you can find recognizable. So let me know if you have any questions. I'd be happy to answer anything.